My name is Micah Derm. This is my speech to Persuade for Fundamentals of Oral Communication with Professor Overstock. So, jumping right into it. Healthcare in 2020 should not put anyone into debt or make them choose finances over their health. Unfortunately, that's the reality many people face when in hospitals or dealing with the healthcare system. In this speech, I'll make compelling arguments as to why the cost of healthcare should decrease and or switch to being universal in the United States. Healthcare is a human right and should be guaranteed. It can be beneficial for our economy and forces medical workers to provide the same standard of care to all patients. There are opposing arguments such as care for health, a toll on the economy, and a decrease in personal patient care. These opposing arguments will be addressed as we address each view. First, we will take a look at the human rights aspect of the issue. Healthcare is a human right and should be guaranteed to every person in the United States. The American Bar Association has even recognized this as a right. In the time of the COVID-19 pandemic, there's a huge debate about personal health. Many want to prevent the spread of all sickness in order to stop the death toll from increasing and save their loved ones. However, people argue that free healthcare will lead to a decrease in personal healthcare, as people will become lazy or irresponsible with their health. As this is a legitimate concern, it is not a legitimate reason to deny healthcare to millions of people as a whole. Healthcare is a human right, and in the time of people getting sick, it is up to medical staff to help and assist those who need it. An article done by Sundler et al. In 2020 states that the United Nations recognizes healthcare as a human right and that health and medical care offered corresponds to the needs and expectations of the citizens of a country. In the paper by Powers in 2015 for Jurisprudence, he recognizes that such an approach to human rights is including a right to decent minimum of health care. Personal health is a responsibility that people need to take part in. It is not the government's responsibility to enforce good hygiene or practices, but it is the government's job to help when those who are in need ask. And any approach to human rights should include health care. The health of its people should be a concern for any government. Because healthcare is a human right, it should be offered to every single citizen. Unfortunately, that's not always the case. Healthcare can benefit the economy in ways that help every person. Opposing arguments may be the universal healthcare will cause an increase in taxes and will destroy the economy. However, in reality, the cost of people paying insurance companies is far higher than the cost of paying for universal healthcare. In a research done by Emmanuel and Fuchs in 2005, it was found that the cost of extending the same coverage to all 250 million Americans under 65 years old is $713 billion. And yes, that is a big number, but it is no more than the $800 billion employers and the government spent today on a health insurance system that leaves 45 million people without coverage. In 2020, Kai et al. Presented data from PLOS Medicine that showed analysis predicted net savings when it comes to universal health care in the United States to single-payer health care. Although there is insurance and Social Security, it doesn't offer enough coverage and it doesn't offer coverage to every person. It costs more to pay for Social Security through taxes rather than just pay for healthcare as a whole through the government. And in hindsight, as much as money is important, it is not more important than the care, health, and the well-being of people. With universal healthcare and the ulterior motive of money eliminated, it is only common sense that the quality of care will be standard throughout all patients. The quality of care in all medical facilities would increase because there's no motivation for money or greed. The argument against this is that there will be a decline in patient care. Yet, this is not the case because doctors and medical workers will be motivated by the desire for a stronger and healthier public health. In Obama's 2007 addressal for how the healthcare system can be improved, he states that universal healthcare will improve the quality of patient care. Obama wants to decrease the cost because he believes and knows it will ease the lives of many Americans struggling. The change will all around improve the ailing system we have by eliminating stressors such as money or worry that one doctor won't be able to provide you as good of care as the next. The idea that more expensive something is, the more value it has, is out of fashion and should have never been in fashion when it comes to something as serious as our health. We shouldn't have to worry about so many factors in order to feel secure about the care we receive from our healthcare system. The purpose of this speech is to inform you as the audience why healthcare is a human right, won't put our tax dollars to waste, and won't devalue the care we receive. The healthcare system should be lowered the cost of care and or become universal in the United States. The American Bar Association has recognized healthcare as a human right that should be guaranteed to all people. The cost can be lowered without risking much damage to the economy, which is a big issue to people everywhere. And former President Barack Obama has concluded that our healthcare value won't decrease simply because our costs are lowered. As you have taken a look at as to why our healthcare costs should be decreased or become universal, I hope you can see the points I've made while addressing opposing views that you may have thought about as well.